Hello, friends, all my homeopathic friends. Welcome to the day 2 of the webcast of One Voice for the COVID that all the homeopaths have got together and made for you guys to combat COVID in this whole scenario where everyone is at real scratching their heads. What all are we supposed to do? I hope you have enjoyed at least the yesterday's presentation. Today we have a combination of one of the best with the younger people presenting to get you to experience what all is possible. The first is Dr. Nimish Mehta, who spearheaded this whole one voice stuff. And all of you know Dr. Nimish Mehta, who's been a professor of Organon and who's been at the forefront of all this teaching modules. He is going to teach you, he's going to show how you can take an acute case of COVID in a short time and come to a prescriptive pattern which will be easy for you to get to treating your patients who you suspect of COVID. And this can be of great help because majority of the things that are now being seen are the mild to moderate cases, and homeopathy can really work and has been working. So I hope this is of use to all of you. In fact, I feel everyone who is going to speak through this webcast through all these 5 days is going to help someone or the other, some patient or the other, definitely. It's a personal opinion, but I'm just trying to impress upon you guys to go through this. The second one is another stalwart and whose name doesn't have to be introduced. He's Dr. Rajan Shankaran. You all know him. He's at the forefront of homeopathy worldwide. And he's going to present the 3 different presentations that, according to his experience, has shown more possibilities in the COVID. I mean, he feels that the COVID disease has presented in these 3 presentations more properly, and how you are able to differentiate them and how you can utilize his experience and his methodology of thought process into your patients when you get that kind of scenario in your patients. The other 2 are the younger lot, Dr. Sonali and Dr. Isha, who are young, but then they have put in their work also. So it will give you that perspective that the biggest in the profession and the youngest in the profession, how both can present it. And that's the whole purpose of this seminar or webcast or whatever name you give to this one voice for COVID. Both these girls are going to present how in the OPD and IPD you can utilize this kind of thought process that the webcast is going to give you to treat COVID patients. I hope you guys enjoy this, and I hope that all of this helps ultimately all the patients of COVID that you people are going to treat. All the best.
I'm glad to introduce Dr. Nimish Mehta, a homeopathic doctor by profession and the coordinator of Tamsoma Jyotirgamaya, which is bringing you this webinar. He is a clinician and an academician with 32 years of experience. He is currently an associate professor at the reputed CMP Homeopathic Medical College in Mumbai. He has been a speaker on at various platforms of ICR and Harry and Liga and the other song CCRH, CCH and Hamai. He has done a significant work in the field of rheumatology, in the field of asthma and COPD. During this pandemic, he has, along with his colleagues, with the teamwork, has treated around 200 or more cases with a very timely and excellent results. He has been a part of COVID research teams in hospitals in Thane and Mumbai. I'm glad to welcome him to this particular session, and I would like to state here that he has been one of the center pillars for organizing this particular webinar. So please welcome Dr. Nimish Mehta.
Hello friends, welcome to one more session of One Voice, the global webinar series for COVID-19. And my topic today is quick case taking. There's a little background to this topic. As soon as the pandemic was discovered, I was reminded of my experiences with dengue cases. And I always felt that the scope of homeopathy is much more in viral conditions than what the world thinks what sometimes even the homeopaths think about it. I'm in company of friends from two organizations, Tamsoma Jyotirgamaya and Integrity Homeopathy. Tamsoma Jyotirgamaya was formed out of senior homeopaths bonded by one friendly orthopedic surgeon, Dr. Mamtura, who was my colleague for all my arthritis and rheumatology work also. We have been working together for creating better clarity amongst younger homeopaths of not getting confused about different schools of thought. And we also have been working towards public at large having a better impression about homeopathy so that it reaches all the governments. Integrative Homeopathy is a group with whom I work for the cases at the hospital. We have some very, very bold COVID warriors inside in the team who have also made presentations here. The company of these genius people, what I realized, what I've learned over the years, and I'm indebted to all of them for that, is that though there are so many evidences about homeopathy being very good in viral conditions, as you can see in the screen, there is enough evidence that we did fantastic work in Andhra Pradesh and Uttar Pradesh in India for Japanese encephalitis. This is documented work, and you can see all these things on YouTube channel of Tamsoma Jyotirgamaya already uploaded. We have evidences about doing very good fundamental research work along with prominent scientists from Institute of Science, from Tata, from IIT. There is a long list. We also have standalone research, not just adjuvant research. Standalone research has been done by CCRH projects. They also been done in small places like Palghar, where Dr. M.L. Davle Institute, their work on conditions like measles is unparalleled. So there is enough details and enough documentation to support homeopathy has a very, very good scope in viral conditions. But there is still a challenge for all of us. The first challenge is because people accuse homeopathy of not being scientific. The second challenge is because homeopaths also, not just the people, believe homeopathy is not so great for acute cases. So in this pandemic, there was a challenge to undo all these impressions. But first of all, let's concentrate on the challenge which we have when we face corona cases. The patients of corona will come to us, but they would want the case taking to be very quick, absolutely effective, and a very, very sure result happening very soon. But what is required if your science has to work successfully is slightly different. We need complete data of the case. We need a proper picture of the case. We need clear characteristics. And we require to work in a way that all the results can be documented. Friends, doing all this work properly, creating results, and also documenting the case, all these challenges we will take because we have to prove to the world. So I was reminded of one organon aphorism, some very, very peculiar words. I teach organon and some words, keep echoing whenever I think of any issue. So 102 says that sketch of the picture, disease picture in an epidemic requires what? It does not require spinning of verbose words, long, long stories. We require significant characteristic and the peculiarities. Don't allow it to be verbose. Don't allow it to be long spun story. Work on getting the absolute picture of the patient, which is characteristic and which is really giving us the result. So I studied a lot of cases from all over, and I studied cases from a lot of sources also. Some of my colleagues of ICR, we shared cases. Some cases were shared by my teacher, Dr. Shankaran, who had cases from Iran. I had a cousin in UK who was helping many corona positive cases in her neighborhood and friends. She gave me some case stories, and I also studied those internet blogs over which people have shared their experience of corona, in very, very nice verbose manner. By all this data, what I could gather, I created a questionnaire which was designed in 3 sets. The whole target was in 10-15 minutes, a patient should be able to give you the story, which will give you maximum data and which covers all the important aspects of the case. So your picture is clear, characteristic, and it gives you perfect result. And that is how I designed this questionnaire, which runs into 3 sets. The set 3 are divided into number 1 set is about complaints, number 2 sets and 3 sets are about physical generals and mind. The set 1 is designed to stimulate the memory, as the organon says. The memory about acute is always very strong. We just have to work on making a patient oriented towards remembering the whole flashback of the story. Once he tells this, he has to answer few more questions in the set, and he'll be reminded of telling us everything that has happened during the complaints, whether he has fever or whether he doesn't have fever. The acute complaint story must come to us completely through these questions. Set 2 and set 3 are important because, one, even in acute prescribing, we need some background of the temperament. You remember the words in pulsatilla that is always given to people of mild disposition. Aconite is never given to mild disposition person. Naxomica is often the irritable, the sultry kind of person. So friends, we require this data for even acute prescribing as notes, as you can read about these in Whitmont's Psych and Substance and read about these in Boger's The Art of Healing book. Set 2 and set 3 questions on chronic data is also required because all acute condition cases don't require acute remedies. Many of them require chronic remedies. In fact, half of them require chronic remedies, as you will see in the presentations by Dr. Fansalkar, Dr. Shankaran, and many others here. Okay, so we require some questions to stimulate person to tell us about the day-to-day life before corona condition occurred to him, and this will definitely point towards a chronic picture. Friends, the most important key factor is flashback. You make them understand how they see a flashback in a movie. That way they need to share the flashback with us when they are giving these case stories. And the questions will lead them. The questions will give all the support, all the reminders, all the stimulation to memory. So here I share with you the experience of one of my colleagues whose parents we treated together. She utilized the same set of questions.
Hello everyone, I'm going to speak about my father's case first. My father is 74 years of age. He is a known case of diabetes mellitus and polycythemia vera. My father has had his first round of fever on 2nd of June. After that there was no fever, but on day 5 or 6 when I see him, I find him disproportionately weak. He had tremendous loss of appetite. This prompted me to give him some basic tests, and in the tests we have LDH and CRP which are high. Also the CBC shows low WBCs, and his X-ray chest suggested further evaluation with CT scan. The MD physician suggested that probably it's recovering COVID and to start HCQS and wait for 3-4 weeks for everything to settle down. But on insistence of Dr. Nimish Mehta, we did the CT scan and confirmed the ground glass appearance and 20 to 30% involvement of the lungs. After that, it was important to give him the right indicated remedy. Before that, he had taken arsenic album 1M for a couple of days, 4 to 5 days, because then there were no complaints except for this weakness. So the fever questionnaire with Dr. Nimish Mehta sent me was very helpful in the way that it elaborates on each and every parameter that we need to know as a homeopath. The peculiar, cure, rare and strange, the PQRS about the fever. With that, we come to an indicated remedy. Also, the second set of questions will speak about the general state, which is the perspiration, dreams, sleep, and the thermal sensitivity, craving aversions, food sensitivity. So with that, we were able to change into the indicated remedy. And in about the second day after introduction of the remedy, we find almost a 20% improvement in his complaints, which was sustained as through the entire week of quarantine that he was there. At the end of which we had to, there was a status quo and it indicated that we need to move to a more deeper acting remedy, and then the set 3 and a chronic picture was taken, which helped us to give him the right deep acting constitutional remedy. And thankfully he's been on the path to recovery. He's recovering well each day. So yes, these finding the PQRS, the fever totality, identifying the generals and identifying the time for introduction of the right remedy are very, very important. Thank you everybody, and thank you Dr. Nimish Mehta.
So friends, the case taking of these 3 set is not a replacement for standard case taking, but it has got some very specific purpose. It gives us the acute picture very well. It is not just focusing on fever totality at all, because no, as you know, in India, there are only 17% patient who had fever. So these sets are designed in a way that you can get to the exact details as you require from the acute totality. Whatever complaints the patient had, you can get access to their memory files. You know, Dr. Dhavle, I used to work with senior Dr. Dhavle, and he used to tell me that the data is lying in cupboard inside the house of the mind. It's your job to go inside and get it. You stimulate the right pattern and get all those memory files out, and you get all the characteristics. So here we go with set 1. The most important question is, what are the first thing that happened to you? This is what I focus even when I talk to them on the phone first before I send them the questionnaire. Please share everything from the time that the complaint started for you. And as the patient go on rolling in that memory files being unfolded, you get data about everything that you require from them, about the acute disease picture, about the acute problems picture. So just focus on the points. Don't allow them to get stuck with some common symptoms. Okay, we need to know what exactly happened, what is exactly the sensation, what is exactly the experience. And in LSMC data, the location, sensation, modality and concomitant data, like the way Boger is said in this post-World War scenario, how we got totalities when patients were desired talking only about their pathological complaints. Here we find the best of the characteristics. For example, burning in eyes every time the fever starts. The rubric burning eyes before chill and before fever was only 3 drugs. Okay, just 3 drugs: China, Bryonia, Rustox. So from 4,000 plus drugs in Materia Medica, you come to 3 drugs with one symptom being understood by you correctly. Patients talk about pains, patients talk about tiredness, sleepiness. I remember one mother told me once, saying that patient has got a headache as a presentation to start with, and along with that she described something funny about the speech. The speech was like as if she was drunk, and that one symptom, you know, gave us the key towards Jalsimium, and Jalsimium aborted the case in no time. So we get unusual combination of symptoms. You get interesting sensations. You get patients talking about anxiety in abdomen and whatnot. You can just understand these are the key points in making the totality. Okay, and look for all the symptoms which are intense. Don't waste time over the common symptom. Acknowledge the patient something good and let him roll on to describe the exact experiences that he is going to. What was happening to the person. The next important thing is about pains and painlessness. Lots of patients don't get any pains at all. That is very, very peculiar of many corona cases, leading us to drugs like arnica, opium, camphor. And there are many cases which are full of pains, okay, and lead us to bryonia, rustox and whatnot. Extreme sensitivity to pains with crying like pulsatilla and sepia, crying even while talking to you about these complaints. And you also get responses of pains with blood pressure increase and the drug pictures like nausea and lachesis coming up. So friends, every symptom counts, just little more. That's my favorite phrase in case taking. Just a little more. Focus on evolution, focus on what has exactly happened, focus on the exact experience, and you are bound to get fantastic symptoms which are going to make your totality very clear in no time. And say even taste bitter. I have found people talking about bitter taste in water and leading to one drug within no time, and that is where exactly our success lies, and that is where it's going to change the whole totality for us. The next point is about the various symptoms which come up along with the fever or the main complaints. See friends, we are not talking about just fever, but we are talking about all the complaints. For example, you get changes in the taste of mouth. There is not just common that people talk about the taste is bitter or taste is bad. You just require to ask little more details, because for example, if just the food is bitter except water, it leads you to just very few drugs like aconite. If water is tasting bitter, it leads you to arsenic, chinars and a few more drugs in the repertory. So just one question little more is going to make such a big difference to the way in which you understand the case and the way in which you will get the totality. One rubric can reduce your list of drugs from 4,000 to just 4 drugs. and that one symptom can lead to such a clarity. Imagine how fast, how easy it is to reach to totality once you reach to such a important information. These questions you give you just that. This set of questions give you just that. Ask about timing of complaints. And friends, I really tell you, people, if you give a little stimulation, they talk about the time modality so well, about fever as well as about the complaints. I've seen 3 p.m. of pulsatilla, 4 p.m. of lycopodium, 12 midnight of arsenic, and so many things. And about thermal state also, remember that don't allow stoic people also to talk less and make things confusing for you. Ask them exactly whether they want air condition with fan, at what speed they want the fan if they are alone in the room, at what kind of covering they are exactly using. Are they using a thin sheet or you are using a blanket? Okay. When you're asking for craving aversion, don't just ask what do you like. Ask exactly what you have such a top favorite. Use words which are near to their experience, and automatically you will start getting a response which is very, very clear. You tell somebody what is no, no, absolutely they don't touch at all. He will answer you about the aversion within no time. So same way about perspiration, when you're asking, ask in a way that he is not embarrassed to tell about things. Okay, it's always very important next to understand about the energy level. Whether you see Dr. Vijaykar's chart, or whether you see cases by Dr. Manoj Patel, my friend, or anybody like Dr. Devadiga, anybody you heard about acute cases, you'll always find energy level one of the most key point. Energy level can be just down, can be very bad weakness, can be fainting, can be just zero. And cases of Iran that Dr. Shankaran shared with me of camphor, there are so many people talking about fainting even before they started feeling weak. So the energy level is very, very clear. Next data, and with energy you also go to next is the sleep, whether the person is sleepy or sleepless, or there is anything happening about that time before, during and after. So it's very important that these complaints are noted very well with respect to timing. Okay, some days before the complaint sleepiness occurring tells you about drug like calcium and acid phos. So same way, go about the mental symptoms also, whether he's feeling sick, he's feeling mentally something odd. See, this last two questions sets that I have created is meant for understanding the chronic. They are not replacement for our standard chronic case thing, but under crisis, if a patient is describing his data or his family member is describing data, they will tell you very clearly with these questions what exactly you are searching for. So it's easy to find the thermal state also, because your family member can always tell you what speed the fan was being chosen by the patient. See, I'm thinking about patients who are in hospital, and maybe half the testing will take place with their relative at times. And that will happen very clearly only if you are going to point with questions which are very well worded. Your wordings must connect to the experience of life. Then only you will get a data which is real time, a data which is useful for making a totality. Don't just ask, okay, complaints or symptoms in a very, very simple way. If you're asking about food aggravation, put it exactly, point it out. And that is how you'll reach to a clear data in all these things. If you're asking about sleep posture, for example, ask them little details. Don't feel shy, don't hesitate. The most important thing homeopaths have to learn is to ask questions without hesitating. If you ask about postures, ask them just lie down on the examination coach and show you the posture if there is some confusion. So once you go to the spontaneous constitutional tendencies, your totality is on such a firm sound basis. Okay, and once you get a firm sound basis about all these things, the case totality eventually works on very well. Same way we need to talk about dreams. Give them little clues. Okay, don't intervene them when they're talking, but ask them to describe. Once you ask them to describe and go on to things, the constitutions change, the weight losses, the changes in the perspiration, you are going to get all these things. Sometimes I've even heard wives of the patient talking about the dreams that they've described some, and at the time in the past. So it's easy to get all these things once you talk about it. Same way about when you go towards the mind also. You see, I have not replaced standard life space investigation. You need to do that. But you might not be able to do that when the time is so short with an acute disease, with an acute complaint. So I ask them simply, what is the state which is most often seen by the patient or by his relatives around? See, somebody's wife can always tell you, just as how much covering they need. They can always also tell you about how do they sweat. Somebody's daughter can tell you how what food craving is there, and this is what we exactly need. Okay, somebody can tell you, my brother when he's anxious at the office he just keeps sweating, even with the air condition he keeps sweating. Somebody's wife can tell you, oh when he gets angry, oh you should see his face, it turns so red. Okay, at times even friends tell you the PQRS, which people have heard from their friends. तू तो यार बात ही नहीं करता है, तेरा मुंह से निकलता ही नहीं है. So people can tell you about many things very clearly if you just put question about most frequent emotional reaction and physical effects of the emotions. These two things remind everything 100% well, and that is what we require to reach. The constitution is in a crisis, in an acute condition, and features have to come out as per what Boger writes. And we have to just concentrate on talking in an intense manner, arousing all the memory so that you will get all these details without missing them. This is the crux of the case taking of these three sets. And let me now go to the case that is coming up. Having said all these things about these sets, let me now quickly share two of my cases which will probably help you to understand how I work with these sets and how do I communicate with these people using these questionnaires. This was the first patient who was referred, a 41-year-old male was referred by a doctor from the hotspot area near my residence. He came because there was a sudden crisis about him according to the doctor. In the first talk that he had, he talked about fever, cough and weakness with fever. He was in treatment from a local doctor and said he will be testing for the COVID test after 2 days. He was convinced as having COVID, as there were surrounding people all having the same illness right now. So it was a suspected case of COVID for us. But the COVID test cannot be done according to the government rules, which was at that time after third day of fever, which was going to be taking place. So he was trying to control symptoms with the local doctor's medicines. The patient had very clear ODP, onset duration progress. And with the questionnaire that I had, I translated into the local language and gave it to him. And he told me the description, which was very interesting. He could write in the way that the questions were posed to him, and we got the following details. As you can see, the local people in India can understand this language, the others can comprehend from the English translation. The temperature was maximum 102. The weakness was with fever. When the fever subsided, the weakness had settled down. Earlier, the temperature maximum was 102 and now it has come down. And the patient has subsequently a recurrence of fever also. His energy levels have been very normal. He has no complaints almost except for a little cough, and that cough also probably is little subsiding. The weakness was there, but it was only with fever. That is very clear. The cough is also getting a little less. So I was wondering as to what's wrong with him. He's saying no problem of mind, no mental symptoms, no thoughts, no pain in the eyes, no other complaints. So what's wrong? What's happening? The patient is very comfortable. Surprising, no? That's where I was just wondering about as to what is he talking about. In very clear words, he has written that except for the post tablet, he never even sweated much, and he's taking something. So the shocking news was that his SpO2 is only 87, and he knew the meaning of the SpO2 because the surrounding people in the slum hotspot, they all talked about this, and everybody's doctors talked about this. So the case is here. He is a case of suspected COVID with a 87 SpO2. We made a quick analysis evaluation of the case. We applied the approach and came to the following evaluation order, as you can see. Friends, we have just three characteristics, but they are very, very powerful. He is absolutely well when he is sick. He is knowing that he is having COVID, but he says, oh, I am fine. I don't have any problem. He has no pains. He has no other symptom, discomforts, no discomforts. So there is irritability, physical lack of in terms of repertory language. And he had a distinct weakness which was during fever. When we look at all these three characteristics, it comes to arnica. And that's what he received. As you can see in the repertory sheet also, it's very, very clear. Arnica was the most prominent drug with all these three characteristics. Yeah. And when sick he is a hallmark. You see Therapeutics of Fever by Allen, arnica picture, you are dead sure of what is the remedy for this case. Yes. Friends, it's important not to just see repertory, see these source books also. Arnica 200 we gave 1 dose because susceptibility is high with all these factors, and we asked him to take 3 pills 3 times a day. We packed the medicine around 7:30. He took the first dose at 8:30, and you can see at 9:30, within an hour after the dose, the SpO2 had turned 95 and the patient was feeling better, quite better. And the next morning he told me that the patient was really doing well. Yeah, we had given the dose and he was really doing well. And the BMC patient, doctor who sees him says, "Oh, you don't seem to have any problem. No test, go away." So we continued the doses twice a day, and the next when he talked to me, he was already having sweating symptoms, perspiration turning salty and sticky, and the food tasting salty. Friends, here we knew we had to stop the doses and look at him. So this is how we understand the case and what's happening to the case. You see there is all these things in a small video.
मला खूपच ताप होता आणि प्रमाणाच्या बाहेर खोकला होता. तर मी सर तुम्हाला सांगितलं होतं, तुमच्याबरोबर माझा कन्सल्टेंट झाला होता की म्हणजे तुम्हाला एक फोन केला होता आणि माझी सगळी होती ती परिस्थिती सांगितली होती मी तुम्हाला. त्यानंतर मग तुम्ही मला औषधे प्रोव्हाइड केली होती. त्या औषधाच्या परिणामाने म्हणजे त्या दिवशी मला ताप फक्त त्याच दिवशी म्हणजे ज्या दिवशी औषध घेतलं त्या दिवशी माझा ताप एकदमच ठणठणीत बरा झाला होता आणि दुसऱ्या दिवशी खोकला एकदमच कमी झाला. तिसऱ्या दिवशी खोकला बरा झाला. खोकला वगैरे आता काही नाही आहे, पण मला ना सर असं म्हणजे म्हणजे थोडासा असा हे येतो, कफ आला ना, कफ आला तर ते खारट असं आंबट वगैरे असं खारट येतो, आंबट नाही आहे आणि एकदम खारट, तोंड एकदम खारट होतं. शिवाय आपण एखाद्या वेळा पंखा वगैरे बंद केला तर जो घाम येतो, घाम आला ना तर त्या घामामध्ये पण असं म्हणजे सॉल्टी असतं, एकदम चिकचिकट आणि म्हणजे त्याला एकदम खारट असा वास असतो त्या घामालाही. मला आता त्याचाच त्रास आहे, बाकी कसलाही त्रास नाही आहे. तर मी पुढे त्याचं काय करायला पाहिजे, औषध कुठलं चालू ठेवू आणि काय करू, याच्यासाठी मी तुम्हाला पुन्हा एकदा माझा हा व्हिडिओ बनवून पाठवतो सर. तुमच्या औषधांचा मला खरंच खूप चांगला परिणाम झाला आणि खूप चांगलं वाटतंय त्या औषधांनी. धन्यवाद सर.
As you have seen, friends, in this case, just few symptoms make it clear totality. Let us now see a little stronger, more worse case. The first one was milder case, though the SpO2 was low. The second case had a clear chest infection. This patient came to me for treatment from 23rd June onwards, though her report was done later and we did it on 28th and then she was hospitalized. This case had a very interesting presentation. Okay. First, with a questionnaire, she described about the fever which was started few days before, where she took paracetamol and all those things, about loss of taste and all she's talking about. Slowly, the situation became worse and she started becoming anxious. She developed symptoms of lot of anxiety and lot of irritability, and she was getting very emotional remembering her mother. A married lady remembering after years her mother and crying, was feeling butterflies in the abdomen with this type of anxiety. And she had this thing going on exactly like this. The pain was first in the limbs a day before the fever started, and she also had a sudden craving for eating something very sweet. Interesting, no friends? See, this is all I have come out with this question set that I am talking about. So these interesting symptoms, characteristics were infallible in trying to create the totality. She had a fever at the time and she was feeling extremely weak and tired with that. When she had fever, she also was having burning in the eyes. Her sleep was very disturbed since few days, and it was all these things was good before she fell ill. This was never the issue earlier, but sleeplessness came up with fever. And so many characteristics, the blood pressure was normal, but as you can see, so many characteristics in such a short write-up. Yeah, they are describing you about all these things. You see, it took just 5 minutes for her to really tell me, write to me all these symptoms, he told. Okay, and as you can see on the slide, we have got symptoms of fear and anxiety with fever, pain in the extremities before fever, weakness which was during fever, sweets desire which is recent, and you come to a repertory sheet which tells you very, very strongly and clearly pulsatilla coming up, covering everything, covering everything. We found some of the symptoms happening in the last 5 days, and they are all very prominent characteristics, prodrome as well as during the fever. And the characteristics of the burning eyes was infallible. So going through this, we came to pulsatilla. We gave 1M potency because, as you can see, there is a very strong susceptibility, very high susceptibility, though their case is having severe changes of chest infection. We gave 3 pills 4 hourly. Her SpO2 was very low. It changed within 10 minutes, as you can see on what copied I had made from the WhatsApp messages. Within 10 minutes, the SpO2 which was low turned to normal very soon. And the experience of the patient has really been so good in terms of the whole symptom changes that she is going through. She's gone through a lot of subjective experience which she later on describes to us in the testimonial also. But if I show you the summary of the symptom changes, you can see that it is not just this change of SpO2 in 10 minutes which is important, but there is something more, much more, that we saw in the next few days. And this change was so convincing to the patient. Through this patient, I have really received so many next patients also, which are coming up to me. And the reports corroborated what was happening. She was, of course, COVID positive, and she's gone about showing us more and more changes of the interleukin was also supportive of the overall clinical state. Friends, interleukin, if it is too high, too much high, then it speaks about the onset of the interstitial fibrosis activity in a bad way. But interleukin, which is moderately high, speaks about the immunity. So the symptomatic change is also very interesting. With initially few doses very often, we reached to a stage where the fever was very soon controlled within a day, the pains were controlled within a day, the weakness took a little time, the cough looked more time. So when she was hospitalized, she was having cough, and the same day then when she called up, I heard the cough sound, and it was definitely the Drosera sound, as we all have read in the books and we have often seen in our OPDs. And with 1 dose of Drosera intervened, and she started improving. So friends, listen to her.
I stay in Mirror Road, and last month I found COVID positive. On the 16th of June in the morning, my body was paining very badly, and in a some time only I just got a very high fever. But normally we thought it's a fever, and I took paracetamol for 3 days. And suddenly I lost the smell of the food and the taste of the food. So then I understood it's not a normal fever, and I consulted to Dr. Nimish Mehta. Sir took my all the symptoms detail and discussed with me all my symptoms. He suggested me get the oximeter, check the oxygen level, and I did the same, but my oxygen level was very low. So he suggested me immediately some homeopathic medicine, which I started, and after that he told me to check every 10 minutes the reading of the oxygen level and send it to him. After taking that medicine, my oxygen level was recovered in the night, and he suggested next day early morning just please go for the COVID test. I did the same thing, and my report found positive. So he guided me not to actually get so worried. He helped me a lot to recover from COVID. So he suggested me some medicine also. So by the time report came, it's already 2 days. So till that I was taking a medicine, and I think he understood before only. So he just suggested me a very good medicine, and the moment I got the report, before that only actually I got my smell and taste back. I was getting so normal, but as per the BMC rule, I get admitted to the hospital. But that time in a hospital, I was so much of acidity and the headache. There also I consulted with Dr. Nimish Mehta, and he suggested me some medicine which I took, and he actually gave me the result. I actually got the cure from those medicine.
So friends, this patient actually incidentally became a standalone homeopathic treatment till she was hospitalized. Her reports took time, and in the meanwhile we got a chance to treat, and she had improved very well even before any medicine beyond that paracetamol was used for her. So I would like to request to all of you, please, all of you, please start treating corona cases as many as possible. All of you means all of you, seniors, juniors, even those people who are practicing, having family doctors practice. Please keep all the cautions, take care of yourself, but design a good quick case taking. See that the patients are feeling nice. Decide between acute and chronic remedies as it's required. My friends in this panel of this global webinar series are presenting all kinds of cases, and I thank them all, my colleagues at Tamsoma Jyotirgamaya and my friends at Integrity Homeopathy. Both of them have helped me to reach where I am today in learning so many concepts and so many experiences. And I also thank Enlightenment Education for providing this platform. And at this moment, I cannot forget my mentor, Dr. Dhaule sir, who ignited me to understand the purpose of my life somewhere apart from this. I would like to re-appeal to all of you that there is nothing so difficult about COVID-19. Let people remember homeopathy and COVID-19 just like people remembered homeopathy and Spanish flu in the past. And we must work together to creating an echo in the world that homeopathy is great for acute cases. Thank you very much.
Dr. Rajan Sankaran is an internationally renowned thinker, teacher, and a writer of homeopathic system of medicine. He is reputed to be clear and original thinker and is best known for his path-breaking concepts in homeopathy. His understanding of disease as a delusion, followed by his discovery of newer miasms, classification of disease states into kingdoms like plants and minerals and animals, and the 7 levels of experience brought in much more clarity into understanding of disease states. This paved one of the most important path-breaking concept of eliciting the vital sensation of the patients, popularly known as the sensation method. The sensation method has now evolved into more comprehensive and synergistic approach which strongly advocates to encompass and integrate the old classical and traditional approaches with latest advances. This approach, the synergy of homeopathy, has resulted in far greater predictability of results than ever before. Dr. Sankaran heads the Other Song International Academy of Advanced Homeopathy in Mumbai. This academy primarily focuses on imparting advanced clinical training to students and practitioners integrated with Homeopathic Healing Center. So, this is my great pleasure to welcome Dr. Rajan Sankaran for this particular session of the webinar. Thank you.
Hello, and it is my pleasure and honor to speak to you about some experiences with treating COVID-19 cases with homeopathy. I want to thank a lot of people who worked with me, Dr. Shrikant Talari, Dr. Gitesh, Dr. Shailendra Honrao, Dr. Shardul, Dr. Sonali, Dr. Faiza, Meghna, Arun, Shiti, the team from the Prana Center in Pune and the Other Song Academy in Mumbai. So basically I've been treating, along with this whole team of people, we have been treating COVID cases. And a few things to tell you about this is that many of these cases were hospitalized cases. And secondly, they were on standard protocol. So they were not standalone homeopathic treatment, but they were also on the standard protocol because that is the law here. And the cases that we will talk about are the ones where we found significant improvement after introducing the homeopathy. So from these cases, I think so far, along with this team of doctors, we must have treated about 200, 250 cases of COVID. And from this, there are certain guidelines or conclusions that I can share with you. The first is that we found in COVID cases, there are 3 levels of symptoms. The first is the symptom of the pandemic. That means what is found in the pandemic. Second is the acute symptoms that you can find. And thirdly, you can find the constitutional remedy or the symptoms of the constitutional remedy. So you find that one of these is prominent at a given time in that particular case. And that is the level that you need to address. So what are the symptoms of the pandemic? One of the symptoms is great weakness and sudden weakness, and especially found in the lower limbs, making it difficult for the person to walk even. And along with this, a kind of loss of smell and taste, which is like an anesthetic kind of state where everything becomes numb in a sense. So this we found, we can see in this pandemic. And also sometimes you find in the mind state a relative lack of anxiety. That means the feeling everything is okay, everything is fine, there's no problem, I'm fine. Or it can be a lot of panic, or feeling to be alone or isolated, forsaken, and very, very scared. So these two extremes of extreme panic, fear, and the other side, a kind of numbness or anesthesia, not feeling anything at all, these are also possible. And I found that the remedy Camphora 1M covers these two extremes of presentation. And therefore, in cases which are asymptomatic or mildly symptomatic, I have used Camphora 1M twice a day for a week or 10 days, and I found very nice results, which I will tell you a little bit later on. These results have been quantified, and what happened we will see. Now, in some cases, you may find acute remedies. And how do you find these acute remedies? You find that there are some peculiarities in the fever, in the time modality, in the location, sensation, and modality and concomitant, in the general state, in the appetite, in the thirst, in the sleep, in the mind state, in the dreams. So something acute has come up with the patient didn't have. And if you find these symptoms, then you can give an acute remedy. And I will suggest you some acute remedies we found useful. And the third presentation is that in the corona also, you find that the main characteristics are actually the symptoms of the patient himself, the constitutional symptoms. And in that case, only that remedy works, and not an acute remedy or not camphora also. So these are the three types of cases that you will have to differentiate in COVID cases. So I would like to give you some case examples, and you can understand. Before that, in the acute, I also found bryonia was coming with the dryness, the thirst, the aversion to being disturbed. Means nobody talk to me, I don't want to leave my bed, I'm comfortable here. And worse from the slightest motion. You know these symptoms, but you find this in COVID cases. Or you can find arsenic also with extreme restlessness, the midnight, the thirst for small quantities often. And you can see this in cases very nicely. Or you can find China with the periodicity, with the bitterness, with the desire for fruits and juices, and with a stimulated state of mind. They cannot sleep because the mind is so active and thoughtful. This can be a presentation. Or gelsemium with its drowsiness and thirstlessness, and somewhere the feeling of being shocked by this whole situation. Oh, how did I get this COVID, etc. So these are some possibilities, but I want to tell you, dear friends, that these remedies are not coming so often. It's not as if that every second case needs arsenic or bryonia or gelsemium. No. If I would put a percentage, I would say maybe bryonia is indicated in something like 10%, arsenic in about 5-7%, something like that. It's not that frequent as you think. what is really coming more frequent? On the one extreme, camphora is coming very frequent in mild and asymptomatic cases. And in symptomatic cases, you find that the constitutional remedy is coming more frequent. And what I want to talk to you is about how to look for this. This is the art of prescribing there. And you have to do it quickly also sometimes. So how to elicit this quickly, I will try to show you through some of the case examples. So if you will take a case 1, it's of a nurse, 28 years old. She says, I feel a lot of weakness. I feel I have no immunity. I have anosmia and I have loss of taste. I have cramps in the calves and thighs. I have numbness in the forearm, weakness in the scapular region. I cannot move because I feel so weak. I want to lie down. I feel numbness of my feet. And, in her home, she has had, her husband hitting her and all that. And what she happens to her with emotion is she faints. She almost loses consciousness. So you see this numbness, loss of consciousness, these kind of reactions that you see are very, very typical of the remedy that we are going to give. And you see her dream, very interesting dream, as if the walls of her house have been blown away by the wind and she is exposed. She has no wall, she has no cover, no protection. And I'm so alone here. This is the dream. So this case is very, very typical when you look in the plant family. In the dicotyledons, you have 6 subclasses. The first subclass is called Magnolidae, in which opium is one remedy. And the main experience of this subclass is the feeling as if that there is no cover, you're exposed and you want to go into a shell. You want to go inside and numb yourself and become anesthetic. This kind of feeling is there. So you can see the sensation is raw and exposed. This is the feeling in the dream. And you can see in this subclass Magnolidae, there are many different orders. And you can see that one of the orders is called Laurels, in which camphor is a remedy. So this is her remedy. This is what she received. She received the feeling of the subclass. There is no skin. Everything is exposed. There is no defense. She says, I have no immunity. I have no defenses. You see? And so she got camphora 1m6 hourly. And this is the follow-up. You can see the headache increased slightly, but the taste and smell started. This is the next day. The cough became 0 and the weakness reduced from 6 to 4. 6.4 means from a scale of 6 to a scale of 4. This is how I write for my own, my own short form. So every day we used to follow her up, and next day, even better, the weakness reduced from 4 to 2, and next day to 1, and then she was completely okay. In about 4 days, she was all right. So this is a typical, example of how camphora manifested. Now we'll see case 2, a 44-year-old male with pain in the lower limb, severe pain, chills at 4 a.m. all over the body, especially on the lower limbs. A lot of weakness, he can't even talk, bitter taste in the mouth. The food will taste salty. The pain in the limbs as if a weight of 10 kilos are tied to his legs. See, the example is given as if a weight, like a vajan is tied to his legs. And he says, I push myself with strength and my pain is better by walking or movement, even though worse from initial motion. He says, I always feel I should work even if I'm ill. I'm better by occupation and I want to take care of other people. So this is one presentation. Now, as you can see here, the main characteristic of this man is, I have to push myself with strength. against resistance. This 10 kilo weight is like a resistance, but I have to push. And when I push and I walk, then I feel better. So this kind of presentation that you see, you can see that if you put the rubrics, here we used MAC repertory and reference works. And if you see the rubrics, you can see food tastes salty, chill beginning in the lower limbs, chill at midnight 4 a.m., and then motion beginning of aggravates, continued ameliorate, occupation ameliorate, and taste bitter. And you see some remedies come up, but you see when you look at these remedies, you can see the second remedy is given ferrum metallicum. And what is the main theme of iron? Iron, which is ferrum, is strength. I have to push myself with strength. I have to use my strength. I have to work against resistance, So this feeling that you saw in this case in his language indicated to me the remedy ferrum metallicum, which you can see is also borne out by all the symptomatology. So when you use, the symptoms and the system, that means the symptoms on one hand and the understanding of the kingdom and the, the sensation on the other hand, then it's a beautiful combination. It's a beautiful combination. This is what I am trying to indicate. So ferrum is coming from the fourth row of the periodic table, and the main idea of the fourth row is strength and stamina and power and resistance. Like how an iron shield is there, like that, that's the idea of ferrum. So he got ferrum metallicum and follow up significantly better. Very soon he did very well with the remedy. So we'll do case 3. Here you can see a 56-year-old female, and she has come with loose motions for 24 hours and cough, breathlessness, malaise, body ache, and stiffness. Better by warm bathing. Worse in the morning on waking. Will I be able to get up and work? And anorexia, loose motions, and a lot of weakness. So these are the presenting complaints, but in that also you see the stiffness, you see the better by warmth, you see the worse in the morning on waking, this kind of symptomatology. But you have to take the totality before you can come to anything. And then what else? She has pain in the abdomen, and she says, I have, a muscular pain as if you have lifted something heavy, this kind of pain, and weakness in the legs in the lumbar region. And she has aversion, nausea from the sight or the thought of tea. So these can be very, very, peculiar indications also. And she has cramps in the back, etc. But then when we asked about her mind symptoms, she said, I have a problem with the hospitals. There is no cleanliness, there is less light and ventilation. I don't like a stuffy environment. I feel oppression in the chest. It is as if I cannot take more breath. Also, when I go into a bathroom, I want to keep the latch open, lest I be locked inside. So this is something very interesting that she said. And her stress was that her cousin committed suicide, and the fear that this cousin who is dead will come, and these thoughts, she says, overpower me. These thoughts, they take control of me. So if you see in anacardium, you see this feeling of being possessed or under superhuman control. And what is anacardium? Now this is also very interesting. Anacardium comes from the Anacardiaceae family. And you see also a little bit more that she dreams of snakes, and she feels this is a good sign because they are a blessing from Shivji, from God Shiva. And she says, when I'm in front of my mother-in-law, I feel as if I'm wrapped up in something, something is around me, tight, and I'm worse in the cloudy weather. So she was given Rustox. Now let's understand a little bit more. Rustox comes from the 5th subclass of the plants, and along with anacardium, along with euphorbiaceae, and all of these, rosaceae. And what is the quality of this main qualities of this subclass? You can see the main feeling is tight, stiff, squeezed, oppressed. And the feeling is, I want to get out, I want to move, I want to change, I'm restless. This kind of feeling, claustrophobic, cannot breathe, cannot take tight clothes. You know this feeling of euphorbiaceae, like he's tied or tight. The feeling of rosaceae, as if he's compressed, as if something has to come out. To study Lorocerasus and remedies like that. So this is the common quality of the fifth subclass. I want to get out. I don't want a latch. I want to move out of here. This hostel itself is very claustrophobic for me. So along with that, you find the stiffness in the morning, better by the warm applications, and the superstitious kind of fear, ghost will come or snake is a Shivji. These are all superstitions, which also you find in Rustox. So the remedy she received was Rustox. Immediately the next day, the cough was status quo, but the diarrhea has gone from 4 to 1, the grade of the diarrhea, from intensity 4 to intensity 1. And then slowly in the next day, the cough improves also. And the next day, no complaints at all. So very quick amelioration of symptoms. In 3-4 days, if you just hit that right remedy, you can see very significant, very quick result. But you have to put so many things together, the symptoms, the mind symptoms, the modalities, the sensation, all of this has to come together. You must know where you are looking, not just symptomatology. But where are you looking? You are looking for a person who feels oppressed, suffocated, want to get out. Where is this coming in our Materia Medica? It's coming mostly in the fifth subclass. Also, it comes in the nitrates like argentum nitricum. You have to understand all this. It can come in a spider. It can come in a carnivorous plant like Drosera. So you must know where you are looking for this kind of sensation. And then you are able to, localize what it is. So this is the way you have to put things together and come to it. So case 4, as you can see in case 4, it's a 41-year-old male. He has fever since 4th of June. And he is a known case of chronic sinusitis since 15 years. He started with coryza and fever on the 1st of June. And high-grade fever with shivering, knee pain, lumbar backache, and pain around the left thigh, feeling there is no strength. The thirst is increased and there is dryness in the fever. So these are some of his presenting complaints. And he has pain at night, in the knees, in the lumbar back. He is restless. I don't know what position to take, he says. Everything is pulsating and throbbing. The throat is burning. I have acidity. I better by drinking tea, warm food, and 12 noon to 6 p.m. aggravates, he says. He has a history of right vocal cord paralysis. And if he shouts, he loses his voice. The headache around the left thigh is very severe with the fever. I become very restless. I want to bang my head against something. I'm just besides myself. I cannot bear it. It's too much. I'm restless. I want to hit my head. It's so much, this pain. Just imagine the intensity of it and his reaction to it. And I have a lot of fear of disease and death. I'm sure I will die. And then he says, I'm sociable. I'm talkative. I control my anger, I am sentimental. And the death of my mother 1 year ago, lot of guilt about that. My first breakup 20 years ago, I feel angry with myself and I have a fear of heart attack. So these are some symptoms you can see. A lot of dreams. I'm trying to save somebody, but I cannot save somebody. I wake up with palpitation and perspiration. So you see, the first remedy we gave him was arsenic alb. As you can see the rubrics again from MAC repertory, you can see coryza from becoming heated, better by warm drinks, wants to hit his head against things, and headache is better by being heated. Conviction of death, I'm sure I'm going to die. Sociable, loquacious, sentimental, reproaches himself. So you can see, and this extreme restlessness, extreme restlessness, fear of death, besides himself with the complaint. These are symptoms of arsenic. And with arsenic, things got better, as you can see from the cough remained the same, but the breathlessness came down. The next day, the throat was better. And slowly, we gave him, and arsenic 1 ml was given every 6 hours. But then what happened is something interesting, that the arsenic didn't solve the problem totally. So he got left with headache around the left eye, and now he gives a modality that it starts at 10 o'clock and lasts till the evening. That means along with the sun, you see, and better by steam. And when we took this into account, we found gelsemium, which was now given to him. So in some cases, you got to shift from arsenic, we had to shift to gelsemium. And with gelsemium, there was further improvement, but we have one more stage we had to reach, that he was left now with a feverish feeling in the evening and with sinusitis with a green discharge. And when we put this and took some of his original symptoms, which was sociable, fear something will happen, dreams of death in the family, we found that he needed medorinum. And medorinum completed his treatment. So in some cases, you need to shift along with the change of symptomatology. So here you don't see arsenic, you don't see that kind of restlessness or fear, etc. But this is what he's left with. And probably medorinum is his constitutional remedy. Now, case number 5. So this is a ward boy in a hospital. He was admitted on 11th June. Fever started on 9th June. He had a dry cough, no weakness, slight dyspnea on exertion and on inhalers with amelioration. He says, people have boycotted me. This disease has distanced me from others. The humanity goes down. There must be love and togetherness. People are suspicious of me and my family. I help others. We must be ever smiling. I am very friendly. I make new friends and acquaintances. So I help so many people, and now I feel, that people are distancing from me because of the COVID. And things like that. So he's chilly, he likes spices, he sweats on the occiput. He was given phosphorus. And this you can see is his constitutional remedy also. With this friendly nature, with the desire for care, with caring, with sympathy, and with easily making, new acquaintances. So you find good qualities of phosphorus. And he was given phosphorus. But now wait, what happened to him? The cough reduced and the breathlessness also came down. But you can see that again the breathlessness went up. You see here the breathlessness is down to 0, from 3 to 0. But the next day it goes up. And when the oxygen is removed, the SpO2 comes down to 85. When you put oxygen, it goes to 95. And then he says, I feel somebody is pressing my throat. So here you see, now you are getting the symptoms of the pandemic, not phosphorus. This is what happens in the pandemic. You get lung symptom, breathlessness, you need oxygen, you get pneumonitis. And these are now the pandemic symptoms are manifest. So we gave him camphora 10 I found people who go into severe breathlessness and, need lot of oxygen and all of this kind of thing. Camphora 10 helps them. Because now the individual symptoms are gone. You only have this. And with camphora 10 the breathlessness improves again from 5 to 3 and then to 2. The oxygen need becomes less, and day by day, he becomes completely okay. On the 6th day, everything is 0. So I told you in severe cases, I'm giving you one example only of a woman of 70. And she says, I don't understand what's happening to me. She's on BiPAP with full oxygen flow and fever and chills. And she says, that I feel very breathless, extreme weakness. I cannot get up, etc. And you can see she's already 70 years old. That means high, risk case. And with so she was given full flow oxygen and camphora 10 m 6 hourly. She made a very, very dramatic recovery, I must say. If I mistake not, this case was from Aurangabad. So sometimes change of symptoms indicate change of remedy. Sometimes you may, you can give camphora and then, which is the pandemic remedy, and then, you get symptoms of arsenic, and then you give arsenic, and then the constitutional symptoms can come up. In one case, China came up afterwards, and that completed the cure. So you must be also ready for this kind of, movement of the case, but nothing routine, nothing, no formula. There's no formula here. It's just you have to go with the case. And how do I select the potency? When I see the emotions and local symptoms, I give 200. When I see general symptoms, dreams and mind state, 1 m. When I see intense symptoms, then 10 m. So that's how I do. Normally, I repeat 3 times or 6 hourly. In more acute situations, every 3 hourly. And when the symptoms abate, then I stop. I want to talk just one more thing. There has been a lot of discussion about, camphora. As you know very well that I had suggested it as a preventive medicine also. And I just want to mention one recent study and then we will stop. This study is from Brazil. And the study is as follows, that there is a city called Itajaí in southern Brazil, and it's in a state called Santa Catarina. And the mayor of Brazil, he gave, the population of the city is about 250,000 people. And he gave camphora 1 dose, 1 m, to 150,000 people. And this was given in April, and in May, some end of May, June, they started a survey. And the survey just got completed last week. And what did they do is that they conducted a survey through an external, agency, Dr. Care. It was hired by the health department of the city, and they sent the survey to all the residents, and 1,171 residents answered the questionnaire. And then they started to study what happened to people who took the camphora and people who didn't take the camphora. And this is in the newspaper, so you can look it up on the internet. Put Itajaí and camphora and COVID and you will get it. So the percentage of the deaths among those who did not take the camphora was about 50% lesser. If you took camphora, the mortality was 50% lesser than those who did not take the camphora. This is what they found. So they made a little bit graph. You see, 43.9% less. The percentage of deaths among those who did not take camphora is this much, and those who took the camphora, it was 43.9% less. So camphora not only kind of acted as a preventive, but even in people who got the COVID, it showed that the morbidity and mortality had been half what it was otherwise. So this was a big trial that was done over there, big research involving more than 900 people on both sides, 900 who took, 900 who didn't. And also they found that the symptoms in the people who took the camphora was about 22% lesser, and they marked it all the symptoms, the fever, the cough, the dyspnea, the myalgia, etc., the pneumonia. And you can see that the green is the one who took camphora, and the intensity of people who didn't take is in black. And you can see across the board, every symptom was lesser. So this is a research survey. I have not done it. It's done by the mayor of Itajai, but it kind of does give some confirmation that camphora could help. So your feedback, your experience, any questions you have, the email covidexperiences@gmail.com, your own experiences. If you have used camphora, you can write that also, other cases also. I am most happy to read them and learn from all of you. All your experiences I would like to pool also together and see how it goes. So this is what I wanted to share with you, my experiences with COVID and what I learned from it, with the aim that it could help you also to treat COVID cases. And as I told you, it requires a judicious use of the repertory, the rubrics, the peculiarities, the case taking, along with the mind symptoms, the mind state, along with the sensation, the experiences, the kingdoms, etc. All of that has to be kind of seen together in one totality, and then you are able to, and definitely, you see, this is a general idea about homeopathy also. I mean, this is also about general homeopathy, that we have to see, that there are 3 levels of prescribing. If somebody gets an injury, we can give him arnica. This is like a pandemic remedy. If somebody gets an acute and the acute symptoms are strong, we give an acute remedy. But in many cases, even in the acute, it is the constitutional symptoms of the person that comes up, and that's where we have to aim. That's where we have to treat most of the time. And you have to keep your ear open for the peculiarity and not routinely prescribe any one remedy or the other, or just, search within a small group. If you think bryonia and arsenic and camphora will solve everything, no, sorry, it doesn't do that. You have to be much more individualized. Yes, and all of these things, about the sensation, the kingdoms, and the various subclasses, superclasses, you have to learn also, along with learning repertory, Materia, Medica, software, all of this. So all this learning comes handy when you go and see cases like that. So it's a great opportunity for homeopathy. And I want to just add one more last thing I want to say, is that we are busy with, doing trials of homeopathy, and this is a great opportunity to do trials. What is a trial? A trial means a randomized controlled trial in which there is placebo given to patients in a randomized way and remedy given to a randomized in a group. And then you see what is the difference in effect between those who got the placebo and those who got the homeopathic treatment. Given that all other conditions are standard, you can give the standard protocol of modern medicine, but you add homeopathy to half the number and give placebo to half the number. And then that is a trial which will be accepted by the scientific community. And also we need to do, like this Brazil research, we need to do mass research as a preventive also. So we are looking forward that there is a strong possibility in Delhi that we might be able to do such a trial of homeopathy as a preventive. And also we need to do trials on homeopathy in intensive care. For example, COVID cases who are on, ventilator, how does homeopathy make a difference? So all of these trials are very important for homeopathy, because we need to clearly use this pandemic, because I can tell you modern medicine has very little to offer in this, very little. One very important doctor from America told me Dr. Shankaran, we have nothing for this. We are on our knees. And this is our chance for homeopathy to prove itself. And we must prove itself not only by anecdotal evidence. I cured this case, I cured 10 cases, I cured 100 cases. This is good. But this is not going to, hold much water with the scientific community. We need to do randomized controlled, placebo controlled studies. This is very important. And if any of you have the possibility to do it, please write to that email which I am telling you. We'll get in touch. I will guide you how to do it also, or you can do it with me. Okay. So good wishes and goodbye.
Dr. Sonali Chapia is an alumni of prestigious Srimati Chandaben Mohanbai Homeopathic Medical College, Mumbai, and graduated in year 2015. She is the founder of House of Homeopathy, an independent homeopathic clinic in Matunga. The zeal to treat her patients and constantly working hard to offer them the best is what drives her every day. Understanding the importance of experience, she has been working with Dr. Nimish Mehta for over 6 years now and has been privileged to assist him in the spectra of cases at his clinics. So, here let's welcome this young and dynamic doctor who has the practical experience of working in the wards of COVID-19 in Mumbai, and she's here to share her experience. So, let's welcome this young and dynamic Dr. Sonali Chapia.
Our journey from O to I. But what is this journey and why the letters O and I? This is our journey of treating COVID patients with homeopathy in the OPD and the IPD. So is O simply a reference for the OPD and I the IPD? It is, but not necessarily our entire idea. From seeing an opportunity of rapid cure in each case to being inspired to do better every moment, every day. An opportunity for us homeopaths to lead our patients to a state of better health, and their course from disease to ease inspires us to work harder and give our very best to each patient.
We have had this privilege to treat patients in both these setups, that is the OPD and the IPD. This journey initially may feel full of uncertainties and doubts, but we are sure once you begin this journey, you will enjoy it as much as we do.
I, Dr. Sonali Chapia, an alumna of Srimati Chandaben Mohanbhai Patel Homeopathic Medical College, practicing since 5 years, am here to share my experiences of treating COVID in the outpatient department.
And I, Dr. Isha Bharatwade, graduated from Srimati Chandaben Mohanbhai Patel Homeopathic Medical College in the year 2018 and into practice since 2 years. I'm here to share my experiences in treating COVID cases in the inpatient departments, that is in the wards. So let's quickly get started and enter this journey, and let's first begin with our OPD.
Thank you, Dr. Isha. Nothing in this world can take the place of persistence. Persistence and determination alone are omnipotent. Zeal will do more than knowledge. Knowledge can be imparted, but being zealous is what drives one to push beyond their doubts. These are a few things I have heard from many around me. My journey with COVID started when the pandemic had risen the levels of anxiety and uncertainty in people's minds. If anyone had a single bout of cough or sneeze, there would be a wave of anxiety in everyone around that person. There was absolute fear and panic all around. I'm sure we've all been a witness to those days. One theory would lead to 10 others, and soon our social media feed was abuzz with COVID-19. That's when we had relatives and friends calling us and seeking advice for their well-being. What should we eat? What should we not eat? What should we drink? What can we do to boost our immunity? How do we take care of ourselves and our loved ones? Such questions were asked to doctors across the globe. Trust me, my state was no different in those days. I, for one, tried calming them down with a hope that it would allay my anxiety too. The entire outlook towards the pandemic was because this virus was so new, so unknown, and there is still so much to discover about it. There was an entire spectrum of people, ranging from some who were not really affected by the disease to those who were cautious and those who had disturbances due to this anxiety. In this anxious state, I had one of my very first patients. My anxiety and his situation, not the best of combinations to work with. That's when I approached my mentor for guidance. Because like all my colleagues, I too wanted to give my best to the patient. Sir spoke to me and not only guided me but even pushed me to take that first step in treating COVID patients. We homeopaths have for years been striving to give our science its due recognition. And maybe this was it. It was an absolute win-win for us practitioners of homeopathy to treat acute cases organically. Now on any normal given day, this patient would enter our clinic and sit right in front of us. And as soon as he would step into our chamber, we would have started observing him. However, we were about to have our new normal, a new normal for doctors as well, and that is telemedicine. The entire case was to be taken on a video call, even though the patient was in the same city just a few kilometers away. Our case taking started as soon as we connected with the patient on the phone. So this is our case number 1. This is the case of a 31-year-old male. The case was entirely taken on telemedicine, our new normal. Case was taken on May 7th and he had reported positive on May 6th. The source of infection, he was a secondary transmission case. Now when I started talking to him, I noticed some anxiety in his voice. And before I could even ask him about it, he told me, I have a 4-month-old daughter and I'm very worried about her health. I have developed COVID, but what if something happens to her? What if she develops some symptoms? What will I do then? What if something happens to her? All these were the questions he put to me. This was the anxiety that he had. Now this was one aspect of his mental state that we understood. Before I could talk to him or ask him about his complaints, I realized the first thing I had to do was to calm him down. I needed that so that even he could describe his symptoms as well as he could. Once we achieved that, we asked him about his complaints. And he told us that he had fever and body ache. Body ache was the pain in extremities that he told us. Now he was asked to narrate his complaints in a flashback, to start from the very beginning. He said it all started with a fever and body ache, and now I feel I've even lost taste for the food I eat. Food tastes absolutely tasteless. I don't know what's the problem there, he said. Going on to the physical generals, his appetite, thirst, stool, urine, all were normal. When we asked him about his sleep, he said, I have not slept since the 3 days I have a fever. We tried to understand what was bothering him and making him sleepless. He said, I tried to sleep, but I'm constantly worried. I'm constantly thinking about my daughter, my family members, how are they doing? Are they doing well? All this just doesn't let me sleep at night. He was a COVID-19 positive case as he was already tested positive. This is our evaluation order. Anxiety, fever during, anxiety, health about relatives, anxiety causing sleeplessness, tastelessness for food, and pain extremities during fever. We asked him to check his temperature at that time and it was 100.9. When we asked him to check his SpO2, he did not have a pulse oximeter. So we told him to ask a family member to get one for him. We repertorized the case and this is the repertory sheet. That is the anxiety, fever during, anxiety, health about relatives, anxiety, sleep during, tastelessness of food, and pain, fever during, aggravation. Now, before I make my prescription, as you see, I always repertorize, then I go back to our source books, our Materia, Medica books. Now, in this case, the remedy prescribed was very clear, and that was arsenic alk 200. It was given as BD to him. Apart from this, I advised him to start taking supplements, that is vitamin D 60k once a week, vitamin C once a day, zinc once a day, and to rest well and have a well balanced diet. Now we got a call from him the same evening as a follow-up. He said, I have a fever again, what do I do? So we spoke to him, we asked him about his other complaints, and we realized he was doing okay. So we told him to continue with arsenic and let us know the next morning. He called us up and he said, I don't have a fever, my body ache is less, my taste is better, I feel a lot calmer and I could sleep through the night. And this was it. We knew our remedy had already started showing its action. Arsenic was asked to be continued, and in 2 days the patient was absolutely well. And he was really happy that he was fine. Even his family members were doing okay. They did not test positive for COVID. Case number 2. I've called it asymptomatic COVID. Why asymptomatic? We'll come to that. Now this case is of a 30-year-old female. This case was as well taken as a telemedicine case. The case was taken on July 15th and she had reported positive on July 13th. This was a secondary transmission case as well. She had a history of coming in contact with 2 positive cases in her house. Her husband and sister-in-law had both tested positive. Now when we asked her complaints, she said, I just have a mild throat pain. So before we could ask anything about that, she said it's already better, it's not there anymore. There were no other symptoms, there were no other changes in her chronic features, no other changes in her genitals. Now what do we do in a case like this? We have to take what we call our chronic case taking, because all we would find was her dispositional qualities. So that's what we did, and we started talking to her as a chronic history. When we started our conversation with the patient, we realized she is someone who's always absorbed in self-pity. There was a marked level of anxiety that I also found in her. When I tried to find out more about her nature, she said that I'm very sensitive. She easily goes into a reaction when someone says something to her, especially when someone tries to correct her, and that's it. Her reaction would be heightened at that time. Coming to her physical genitals, her appetite, thirst, stool, urine was all fine. She had a marked craving for sour. There was nothing specific in her aversions. Sleep was on sides and she always had salivation during sleep. When we asked her about her dreams, she said, I have a lot of dreams. Which should I tell you about? So we asked her to describe all her dreams that she could recollect. The dreams that she recollected for us were not being able to complete her work, being unprepared for exams, not finishing her exams in time, so on and so forth. Dreams were filled with the themes of anxiety and unsuccessful efforts. She was afebrile and her SpO2 was 98. We come to our evaluation order: contradiction intolerant of, pities herself, salivation sleep during, sleep side on, dreams anxious, dreams unsuccessful efforts, and desires sour. This is our repertory sheet, and the prescription that I came to was Ignatia. Such a heightened level of sensitivity and so much of reaction. So yes, Ignatia 200 BD was prescribed to her. We even advised her to start taking vitamin D 60k once a week, vitamin C once a day, zinc once a day, to rest well and have a well-balanced diet. The patient is doing well and did not develop any troubles later on related to COVID. She is under our care for chronic complaints of GERD. Now my last case that I have to talk to you all about is that of a 40-year-old female. It is a telemedicine case and the case was taken on June 2nd. A secondary transmission case. When I started talking to her, I asked her about her complaints and she said, I have fever and body ache. We asked her to describe the body ache and she said that I have pain in my limbs. Haath pair mein dard hai mujhe. So I asked her more about it. She said kabhi pains in the hands, sometimes pains in the legs. We asked her a little more to describe a little better. She said no pain in what part was fixed. Pains were moving. Pain kabhi idhar, kabhi udhar, aise hote rehta hai mujhe. So this is what we call the classic shifting or wandering pains. The fever episode was once last night and then just 2 to 3 hours before she had called us up. Now, both the times I asked her if she had taken any medicine for the fever, and she said, I did not take anything. And I asked her for how long did the fever last. She said it lasted for maybe 1.5 hours, and it had subsided on its own. Now, with this morning episode of fever, she said I had a lot of giddiness. We asked her if it was prior to her complaints to understand whether it was prodrome or not. And she said it was not there before the fever, but it was there once last night also when she had a fever. Now we asked her about her first complaint, and she said that it was a headache. One interesting observation she told me was noticed by her husband. She said that I've been having a lot of burps, that is eruptations, and it was there in the evening, means it was there a few hours before her fever. And this was not a part of a chronic recurrent feature. So it was considered to be a part of the prodrome as well. She had been feeling very tired and was just lying in bed. मैं बस पूरा दिन पलंग में बैठी हूँ, मुझे कुछ करना नहीं है. I don't feel like doing anything. I am not sleepy, but I just want to lie down and rest, is what she told us. When we asked her about her physical generals, she said, my appetite is so low since I have a fever. I have practically not eaten anything since last night. Thirst was normal and she was constipated. Now we asked her about this constipation, and it was definitely a chronic feature. Urine, perspiration, sleep was all okay. As we said, she had not taken any medicine for her complaints. Now when we started talking to her, we asked her to check her temperature again, and it was already rising. It was 100 at that time, and her SpO2 was 96. So we asked her to get the following investigations done: the RT-PCR for SARS-CoV-2, a CBC, ESR, CRP, ferritin, LDH, D-dimer, and a provisional diagnosis was COVID-19. This is our evaluation order: fever paroxysmal, headache before fever, eruptations before fever, vertigo during fever, extremities pain during fever, extremities pain shifting, wandering, weakness during fever, and appetite reduced during fever. Here is our repertory sheet, and we have two remedies very close, that's arsenic and sepia. Now we did our reference works again, and we came to arsenic alb 1 mTDS. Here as well, we asked her to take her supplements of vitamin D 60K once a week, vitamin C once a day, and zinc once a day. We asked her to rest and eat well and take care of herself. Now next morning she called us up and said, I had fever once again last night, but I don't have a fever after that. My pains are better, my appetite is better, but my weakness is still the same. I'm still feeling tired. We told her to continue arsenic as it is. The next morning she called us up and said pains are a lot better, weakness is a little better, appetite had restored to its normal. We continued arsenic as it is. Now the only complaint that she had was persisting weakness. Now that continued for 2.5 days more. After that she was okay. The patient is under our care for her chronic complaints. The repertory and the reference works that we have used is the synthesis repertory. We have referred to the Encyclopedia of Pure Materia Medica by T.F. Allen, keynotes by H.C. Allen, and lectures by J.T. Kent. If I have to summarize and give a gist of everything, COVID cases are broadly symptomatic and asymptomatic. In symptomatic cases, we can have an acute totality, and that can be made with a quick acute case taking. Now, acute totality has to be asked by going into the causation, the prodrome, and the entire evolution of symptoms. The changes in physical and mental generals are also very, very important. The entire ODP of each symptom is very crucial and should not be missed. Asymptomatic COVID are the cases that I told you, like in case number 2. There we need an in-depth case taking, as we see only dispositional qualities, and a chronic totality should be formed in such cases. A few quick tips. Always guide your patients to report their temperature and SpO2 at regular intervals. Now patients might forget, might not realize the importance. So if they forget, please take the initiative, call them up and tell them to record it. Guide patients about self-isolation. Most of the patients are aware of it, but do remind them about staying in that one room, using one washroom if they have it, vessels, clothes, cleaning them, all of that should be explained to them. Take a video consent from your patients before you start treating them. Very important, even medico-legally. Maintain a proper record of your cases and reports. Trust me, it was very handy even when I had to put this up for all of you. It's very important to have a proper documented case. Do not forget what I call ZCD, that is zinc, vitamin C and vitamin D. COVID positive and COVID suspect cases, as far as possible, please take cases on telemedicine. And most importantly, the entire idea that I want to share with you all, do not hesitate to treat COVID patients. Take that first important step. If you need any guidance, just ask for help. And help will always be given to those who ask for it. In case of dropping SpO2 or heightened level of distress, always refer cases to the IPD. Let us now see how we take cases and work in the IPD.
I'm extremely glad to welcome Dr. Isha Ved, a young, dynamic, and a passionate physician, a proud graduate from Srimati Chandaben Mohanbai Patel Homeopathic Medical College, Mumbai. She is a very important member of this team as she was the one who took all the risk to enter into COVID-19 hospital scenarios to get the first-hand experience of case taking and handling the patients at the front end. And she has been working with COVID-19 since then. She's known for her ease of using various techniques in case taking, and she's extremely popular with all age groups of patient. She's very warm and caring towards the patient and believes that different schools of homeopathy only add to the power of the homeopath and helps them broaden the horizons. So here I am, extremely happy to introduce Dr. Isha, who has her own office to practice in healing space at Mira Road in Mumbai, and her special interest really lies in parenting field. So let's welcome Dr. Isha, who's been one of the strong team member of this particular Tamsoma Jyotirgamaya, who ventured into COVID-19 scenario as a front-end warrior very early when COVID-19 got introduced into Mumbai. Glad to introduce Dr. Isha once again, and let's understand what this young and dynamic physician has to share with us. Thank you.
So, a journey inside the walls, that is the IPD. So, when this entire COVID scenario began to surface and spread in our country, we as young doctors always wanted to be a part to serve and treat COVID patients. One thing that would constantly be in our minds as homeopaths, that why not treat these COVID patients in the wards with homeopathy? Since we apply homeopathy daily in practice and we know how effective the results are, and sometimes they are just like miracles. So all our dreams and all that we had in our mind of treating these patients with homeopathy molded into a reality, and we all got a chance to go and visit patients in the inpatient department, see them and prescribe them. Thousands of fears, lots of uncertainties, all of these were silenced by just one word, and that was intent. Intent to help, intent to serve. And that's how our journey began in the wards, with that first step. So when we entered the wards, we just paused for a moment and we looked around. Every patient was different, representing individualization in the truest sense. Some were lying quietly, some were in distress, some were walking around, some were talking, some were all aloof. Everybody in a different body language, different body posture, and a different body gesture. So that time we all realized that with that first step in the IPD, our case taking starts. But importantly is that we have to be very keen and very alert, because we have to observe multiple patients. So with all these thoughts and all these understandings, we moved ahead. And amidst all this that was happening, we saw one lady who happened to be our first patient conversing with the sister that she was not comfortable with the position of the bed where she was right now. Where she was currently, she was not comfortable with that position. So she was requesting the sister to get her bed shifted to another spot wherein there were 6 to 7 other females. She expressed her discomfort that she was very scared as her bed, which was there right now, was in the corner, and she felt very scared, especially at night in the dark. She said that at home also she would constantly need somebody to be there with her. So in this normal conversation, the characteristic that was manifested was her fear. So we took this as the anchor and we carried out further conversation with her, understood her distress, probed into her physical generals, probed into her physical particulars, and combining all of these, we could beautifully prescribe a remedy to her. So that was our first learning, that how to comfort the patient, and in normal conversations, how can we elicit peculiar characteristics. So that was our first experience in the IPD. Moving on further, let's discuss 2 cases. So our first case is the case of claustrophobic suffocation. So this patient was a 54-year-old male, COVID positive. First report came on 23rd of July. He got admitted on the 24th and we happened to meet him on the morning of 25th of July. He was a secondary transmission case and 4 other members of his family were. When we first met him, we saw that he was having too much of discomfort and distress on his face. So we asked him that what is currently very bothersome to you right now. And he described that he had this feeling of oppression in the chest. Feels as if my breath will stop now and I can't lie down. सबसे ज़्यादा ये तकलीफ, this suffocation feeling, this oppression feeling which he had, he described that was the maximum whenever he used to enter any closed space like a bathroom or a washroom, to the extent that he couldn't even go daily for completing his course in the washroom and bathroom. He would come out in a fraction of seconds, coughing and feeling suffocated and almost panting. His SpO2 levels would go down somewhere to 86, 87. He said other thing, that something he felt stuck in his throat. He said कि cough जैसा कुछ तो लगता है, something like cough is stuck in my throat. I feel a lot of weakness. He said that sometimes when I cough too loudly, my head pains and I feel a little giddy. छाती पूरा जाम लगता है. जब भी डकारे आती है, whenever I have eructations or burps, I feel better. गरम वातावरण अच्छा नहीं लगता. I don't like warm atmosphere. I can't take warm things. The only thing, when we asked him that if anything was there that would ease his discomfort or distress of suffocation, he said that only one thing, that if there is a fan nearby, I would feel better. And the other thing that he said was eructations. So he requested the staff members to keep a fan near his bed so that it would comfort his sense of suffocation. Said बहुत कमजोरी लगता है, I feel very weak, I feel like lying down, but then I feel suffocated, so I can't do that even. Dating back to his onset, he said that he had an episode of fever a few days back, no chills, but his body was burning in heat. In the generals, the thirst and sleep were characteristic. He said that I can't drink too much of water at a time, so I take small quantities. About his sleep, he said that I could not sleep. I'm not able to sleep because I feel my breath will stop. So the very marked characteristic in his case was this oppression, marked oppression in closed spaces. Because not every case of dyspnea will represent as claustrophobia. So this was a marked characteristic. His oppression, his suffocation feeling was better by fanning, better by eructations. Amongst the generals, thirst for small quantities during fever and sensation of something stuck in the throat. So we repertorized his case and gave him a remedy in the 30 potency, thrice a day. So next day when we went to give him the medicines, he was already on oxygen support because he was in distress. So after we gave this patient the first dose of the medicine, he started, within 15 minutes, he started experiencing severe distress and discomfort. His sense of suffocation was increasing. He was not feeling comfortable. And his distress and discomfort was making my anxiety to rise to heights. Then we examined him, and all the remedy reactions that we learned during our college times started to pop up in my mind. And then after careful examination of his complaints and his SpO2 and his pulse, we decided to wait for a while and observe what is happening. So I assured him that after seeing other patients, we will come back to him and examine him again. So after 2 hours, we came back to him and he was a little comforted. And I was a little relieved that now we can continue with the remedy. So then we decided to continue with the remedy and took his follow-up again in the evening because he was in distress, and in such patients who require a little frequent monitoring, we tend to take their follow-ups twice or even thrice a day via call. So we gave him a call in the evening and he expressed that he was feeling much better. He can breathe comfortably now. Cough is there but feel a little better than yesterday. So the remedy reaction we understood was aggravation followed by amelioration, and we decided to continue the remedy. The next day when we took his follow-up, he reported that his O2 was removed. Doctors told that he will not require any external oxygen support now. He was able to go to the washroom and bathroom, and that was the biggest change. That was the characteristic of dyspnea that we were talking about, and that was somewhere the basis of our prescription. And he was able to visit the bathroom and washroom without having that sense of discomfort. He told that he felt a little breathless coming out, but initially he had this entire fear only of going inside because he knew the amount and severity of discomfort that he had. So that had mellowed down, and with that our anxiety also mellowed down, and then we had a boost in our confidence, and then we decided to continue the remedy. He was able to eat better, his cough was less than before. He said that too much of expectoration came out in the morning. Again in the evening he told that he is better, that didn't require any O2. His SpO2 now without any external oxygen support was 95-96. Remedy reaction, amelioration. 20th July again he reported that he is doing quite well. Can eat comfortably, can lie down. Little suffocative feeling is there and there is a little cough, but he didn't require any oxygen support externally. On the 30th of July, so we saw him we prescribed him on 26th of July, and by 30th of July he was completely okay and was declared fit for discharge. He is now home quarantined and is still in contact with us and is doing immensely better. No ghabrat, no that sense of feeling of suffocation, no oppression, all is gone. So these two examples, like the first I narrated of the lady and the second of this patient, taught us that how focusing on the current distress, like what is the current distress of the patient, especially when they are in wards. So we have to focus more on that, and then we can move towards the peripheral detail, because once that is relieved, even the patient feels a little comfortable and even you get a boost to help him a little better. So this was one case of breathlessness, dyspnea that we saw. Another case, before proceeding to that, what was the remedy given to this patient? So these were the symptoms that we took. We had given him lachesis. So mind, fear, narrow place in, general span being ameliorates, chest oppression, eructations ameliorates, and stomach thirst, small quantities spoke. So our clear-cut differential remedies, we all know that these are the features of carbo-veg and lachesis, very close. Lycopodium also very close in this case. But after we had a proper study from the reference books, we decided to give him lachesis. He was a warm patient, and his other particulars, all the symptoms that he described from the reference work, it exactly tallied lachesis. So we had given him this remedy, lachesis. The next case we move on to is the case of sleep aggravation. This is a very beautiful case, and this got us into another insight into the IPD case taking and case understanding and prescribing. So this is a case of a 43-year-old female. She was reported COVID positive on 24th, got admitted on the same day, and we happened to see her a day after her admission, that is on the 26th. Again, she was a source of secondary infection. 4 members in the family were tested positive. So we asked her to describe her complaints since the onset. So she said Wednesday her husband had fever, Friday her mother-in-law had fever, and on Saturday she developed fever. Further, she described about the fever episode. Fever initially began with mild chills, then chills were more in the back, They were so severe that it would shiver her up. And the other complaint that she was experiencing was of breathlessness, dyspnea. Dyspnea at rest, dyspnea talking, lying. Only one thing she said that made her dyspnea better was sitting erect. ताट बसलं की बरं वाटते. That's what she described. On lying, she would get a sudden bout of cough and she would sit up. Appetite, she said that she didn't feel like eating anything. No cravings, no aversions. Amongst altered sensations, there was alteration in the taste, which was initially bitter, and now there was tastelessness. Regarding thirst, she said that she experiences a lot of dryness in the mouth and throat, and that's what makes her a little thirsty. About her sleep, she said, whenever I am sleeping, I feel as if I am half awake. I don't realize whether I am sleeping or whether I am awake. And then, whenever she would try and get a little sleep, she would wake up at midnight with this sense of suffocation. Now that sense of suffocation was so overpowering for her that even the thought of sleep would aggravate her. Another important peculiar aspect which came up in her case was this dreams of past events. They were not pleasant, but she couldn't remember them. They were not pleasant, that's what she remembered. And these dreams started to appear since the onset of these complaints. Previously, she wouldn't get these dreams, but since the complaints started, she started getting these dreams. And inquiring about her comorbidities, she had this comorbidity of valvular heart disease. Now, why do we note down comorbidities and why is it essential for us and how do we use it in prescribing is something that we learned very interestingly. Now, comorbidities make a person susceptible to acquire the infection more quicker than compared to the other fellow individuals. Also, the extent and the severity of the disease acquired will be somewhere linked, decided by this comorbidity. So, it's very important and essential to understand the comorbidity of the patient as it will grossly determine the severity and extent of his pathology or her pathology. So, we prescribed her a remedy and we took a follow-up on the next day. She said that she could sleep better, she started feeling better, didn't have that feeling of suffocation, no suffocative attacks, and that's the best part. When the generals improve, the patient has to improve. And that actually was a main concern. That sense of suffocation at night was a main concern and that improved. On 28th, we again took a follow-up. Cough, which she didn't speak much about initially, except that part of being erect, and then her cough and suffocation would go down. She said that the cough also that she had became considerably better. Breathing is much better now and no dreams or no suffocative attacks at night. And then we happened to meet her in person the same day and she appeared much fresh than what we had seen her on the first day. 29th, she was better. 30th, her SpO2 levels came between 96 to 97, somewhere between that range, 94 to 97. And then on 30th July, she was declared fit for discharge. Feels almost like normal, much better now. She is again home quarantined and she is doing quite well. So we have this habit of keeping a touch with patients even after they are discharged, 7 days and 15 days follow-up. We tend to do that and understand how has the remedy helped the patient and to what extent. So the rubrics we took was respiration difficult sitting erect ameliorates, respiration difficult sleep during aggravates, dreams events pass long. This was important. The part of dreams was important because it was recent. It was manifested when this acute issue started. So we had these remedies of differentiation. We would think of sleep aggravation, then the Ophidia group would come to our mind. But this acute manifestation of the distress, and likewise remedies would come to our mind, but this acute manifestation of the respiratory discomfort and distress that she was having, coupled with her comorbidity that made her more susceptible to acquire that infection, and comorbidity at such a young age, made us come to the remedy of spongia. And we understood when we read spongia from the reference book, we understood that it was the exact book picture of spongia which she was describing to us, as if spongia had come live. So this case was an immense important learning of how to incorporate comorbidities into cases in the IPD And that was very important learning for all of us. So these were the two cases that we wanted to share with you all. And now just going through the reference works that we use, the repertories that we use, BBCR a special mention. And now quick insights of whatever we feel is important in the IPD setup, and that's what we are trying to share with you all. Working on finer differentials is very important, especially when we are working in an IPD setup, because the patients are in acute and they may require frequent changes in the remedy if the remedy isn't helping quite quick enough. So we need to have a backup plan. And the day you take the case, a thorough workout at the same day is very essential, as the details are very fresh in your mind and they are very crisp. And that adds to precision in the prescription. Now, whenever we are in IPD, one very important aspect is that our questions have to be very wise and very precise. And we have to avoid unnecessary questioning, because we have to minimize our exposure levels. So we can't have a very lengthy procedure. Keeping in mind the comorbidity by understanding the patient is very important. Focusing on what is very much distressing to the patient. Now, why this is very essential? Because if the patient is on oxygen support externally, that itself makes him a little discomfort. That itself gives him a little discomfort and he feels uncomfortable in communicating. So it is very important to focus on what is very much distressing the patient at that moment, and then we can move on to collecting the peripheral details. The central distress can be anything. So if a patient is on O2, maybe anxiety about family can be a major concern. So whatever is the central bothering issue has to be focused upon first. Taking the consent of the patient and explaining them about the procedure, medicines, follow-ups, how things are going to work out is very, very important. Keeping self and colleagues who accompany you safe is utmost importance in IPD. Checking the investigations is very, very crucial, like in any other case, but special emphasis in the IPD, because it guides towards the location of the disease, it guides towards the intensity and severity of the pathology, and it decides the prognosis of the case. Examining again is a very important parameter, because certain IPD remedy differences are based on examining the patients, like redness of the conjunctiva, the pulse, the proportion with the temperature. All these are very, very important while we examine the patient, and that's also very important in part of prescribing. And last but not the least, anywhere, anything you feel is doubtful, always seek help. So this was just a glimpse of our journey into the OPD and the IPD setups treating COVID cases. We are very, very eager to be a part of your journey too, and we wish to hear from your side.
We have been truly blessed to have a team of teachers who guide us always. Thank you all for your presence.
I'm sure you're having a great time gathering knowledge from various stalwarts on the same platform. Today we learned points on quick history taking in COVID-19 cases, the various three typical COVID-19 presentations, and how to approach patients in your outpatient and inpatient departments of the hospital. Also, stay tuned for something interesting coming up tomorrow on day 3 of our One Voice webinar series. You will be hearing the art of case taking in the hospital by Dr. Shailendra Vaishampayan, as well as importance of bedside case taking by Dr. Kirti Mutreja. Following these sessions, we will have a session on role of miasm and susceptibility in COVID-19 cases by Dr. Praful Barwalia. And do not miss this session, as these two form the most important pillars of our accurate prescribing. The last session on day 3 will focus on management of mild cases of COVID-19 by Dr. Jawahar Shah. So, keep learning and we'll see you tomorrow. Bye-bye.